So the differential diagnosis provided by the ChatGPT closely align with the clinical research, like the psoriasis, tinea capitis, and seborrheic dermatitis. So next picture. What differential diagnosis would you think about? So this is the answer from the ChatGPT. ChatGPT can quickly identify this is a possible case of tinea capitis. So it's further explain its clinical feature, like the ring-shaped lesion, scaling, and even potential localized hair loss. So the third picture shows a genital lesion. So in its response, the ChatGPT suggests several possible differential diagnoses, explain the malignancy, the EMPD, and fungal infection, inverse psoriasis, and the contact dermatitis. So this shows AI's ability to provide multiple potential diagnoses and can help clinician, even our patient, in refining their diagnostic approach. So in this section, I will introduce how AI can contribute to the evidence-based medicine using psoriasis treatment as an example.
In contrast, the pathology domain doesn't have many data sets compared to radiology because it is mainly used as a confirmatory test, which was a limitation in developing AI model in the early days. However, the pathology data has more predictive power in predicting a patient prognosis or response to treatment because AI model can directly analyze the state of the patient pathological tissue. So this is why pathology has highlighted recently, especially in oncology. The same is true for dermatology. The earliest dermatology AI model were based on clinical photos or dermoscopy images, and AI model based on skin pathology came later. Only dermatopathology AI model performed not as good as pathologists. For example, an AI model that classified melanoma and nevi misclassified about 20% of cases. In another study, AI model differentiate.
So where are we standing in the digital transformation in medicine? The radiologists are using it already since years. So the first thing is the application of the eye, and then they start thinking about the image interpretation. Also in pathology, AI is used for histology interpretation, and even in classical dermatology, AI technologies are assisting in terms of skin cancer screening with an reliability up to 90%. That's my understanding. So where we are in aesthetic medicine, yeah, the more experienced the physicians are, the better for the patients, but each assessment of the doctor remains at the end subjective. We have the imaging systems. They became better over the years, but there are a lot of open questions to be answered, and the validated grading scales, they are doing still their job in clinical studies. However, validated scales are restricted to single landmarks only, and the anthropometric measurements are also, yeah, that's a separate thing, and that's a smart tool. It's not, when you say investing, you're probably thinking also about the time that you're investing. In terms of the budget, it's not a big budget, since that must not be done always with the rigid, huge Canfield systems. You can do it with an iPhone, or you can do it with an iPad. That's much appreciated by the physicians. And of course, it is key for success that you do it under standardized condition. Yeah, you put it in a ring light, and you have consistent lightening distance and so on. You know this better than me, maybe. And then the data are available on your desktop, web-based. So the doctor can have a look on the data of the outcomes of the situation, and then can start the consultation with the patient. And the initial learning, so we are on the learning curve, yeah, since it is quite new. So what the